name is Chrissy Green. I'm a student at St. Thomas University, and this will be an assessment of the musculoskeletal system. This is my patient. Her name is Amber. She's 21 years old. So when assessing for the musculoskeletal system, the first thing I'm going to do is have my patient stand up, and I'm going to turn her to the side and have her just slightly lean forward a little bit, and I'm going to check down her spinal column. I'm just going to palpate down her spinal column. And when I palpate down her spinal column, I'm going to check to make sure she has this lumbar concavity right here, which she does. And just lean forward, okay, so it's intact. And I'm checking for symmetry. So far, it seems to be symmetrical. Everything seems to be intact. That's good. Now I'm going to have her, I apologize again, this bed is high. Hop up on the bed. Now, I'm going to be checking, when I'm checking for the musculoskeletal system or examining or assessing the musculoskeletal system, I'm checking for swelling, tenderness, pain, and crepitus. So right now, let's start with the head. We're going to go from the top to the bottom. I'm going to place my hand behind the back of her head and underneath her chin, and you can come a little bit closer. So I'm going to be flexing the muscles. And I'm going to have you tell me if you feel any, like the slightest pain, tenderness, just anything within these joints. So I'm going to flex her head forward. And then extend it back. Flex it forward. Okay? Now I'm going to check for rotation. So I'm going to turn it to the left. And then I will turn it to the right. Now I'm going to check for lateral rotation. I'm going to check to see if her ear could touch her shoulder. So I'm going to do it that way, and then I'm going to do on the opposite side this way. Do you have any pain and do you have any swelling? Mm-hmm. All right, perfect. The next thing I'm going to do is check for the joints in her shoulder. So I'm going to lay her down. I'm going to take off her shoes. Turn her around, lay her down. She can lay down flat. And I'm just going to simply lift her arm up and down. I'm going to flex it and extend it. So I'm going to lift it up, flex it, and, well, she's kind of long, and extend it on both sides. Let me know if you have any pain. So flexion and extension. All right, you have any pain?
No.
All right, now the next thing I'm going to do is I'm going to adduct, meaning I'm going to add to the body. So if I'm going to add to the body, I'm going to be doing adduction, which means I'm going to take her arm across the center of her body. I'm going to be adding to the body and checking, and what I'm doing is checking the shoulder to see if she has any joint pain, tenderness, swelling, and I'm also checking for crepitus. And then she doesn't have any. Then I'm going to abduct, which is to take away. And I'm going to take it around to move this shoulder completely around to work the shoulder for like a full range of motion to see if she has any pain. You have any pain?
No.
All right, perfect. Then I'll bring that back down. So now I'll do the same with this. Oh, adduction, adding to the body, abduction. Usually I'll come around, but this is not a hospital bed. It's too wide. So I'm checking the shoulder and I'm checking for the full range of motion. So she's able to complete the full range of motion on both sides without tenderness, pain, or crepitus. Now after I do that, I'm going to flex her arm like this, and I'm gonna check for internal and external rotation. So external rotation, internal rotation. I'm gonna flex this arm, external rotation, internal rotation. You have any pain?
No.
All right, the next thing I'm going to do is I'm going to check the elbow. And I'm just going to flex the elbow and extend the elbow while supporting it. Flex the elbow and extend the elbow. Now, another thing I want to check for is, it's called supination, which is like holding like a bowl of soup. She's able to turn her arm, which is what we call supination. And then pronation, you turn it over. Let me check the opposite side. Supination, pronation. It's perfect. All right, now I'm also going to check her wrist. I'm going to check her wrist. I'm going to check for flexion. You getting this? Extension and hyper extension. Check and see. So flexion, extension, and hyperextension. Now, I'm also going to be checking for radial deviation, which I'll take the hand towards the radial, and then for ulnar deviation, I'll do that on both sides, radial and ulnar. Then I'm going to flex her fingers. I'm going to flex all the fingers to make sure that she could bend them and flex them. Then I will abduct all the fingers. Make sure she could properly spread the fingers apart, and she can. Now I'm going to check for opposition with the thumb, which is where I take the thumb across the palm of her hand to make sure that it can reach, and it can. And I will check to see if her thumb could touch at the base of each finger, and it can. Let me check to make sure she could flex all the fingers. Let me abduct all the fingers. All right, let me check the thumb. I'm going to be doing opposition. And check for the base of each finger. All right, now another thing I need to do, did I do everything with the wrist? Let me check. Let me check her hip. The next thing I want to do with the hip is I'm going to flex the knee. I'm going to flex this leg muscle. And she's able to flex. She's able to flex both legs. Then I'm going to abduct, which is to take away, to make sure she could do that. And then I'm going to adduct and cross over to see if she could complete that range of motion, as she can. So I'm going to take away. She can. And then cross over. Now I'm going to check for internal rotation of the hip. Internal rotation. External rotation. Internal rotation. External rotation. Now I'm going to check her feet and her ankles. Dorsiflexion, plantar flexion. I'm going to abduct the toes to make sure that they could abduct. Then internal, external rotation, internal, external rotation. And I did have her tell me if she has any pain, tenderness, swelling. I did check for crepitation, and she doesn't have any. And this will conclude the assessment of the musculoskeletal system. Thank you.